Start off with our usual update from Gaza. Our humanitarian colleagues are telling us that between the 1st and the 10th of January, only 3 out of the 21 planned aid deliveries of food, medicine, water, and other life-saving supplies to north of Wadi Gaza were able to proceed. These included multiple planned missions to provide medical supplies to Gaza City and fuel to water and sanitation facilities in Gaza City and the north, and those were denied by the Israeli authorities. The UN's ability to respond to extensive needs in the northern part of Gaza is being curtailed by recurring denials of access for aid deliveries and lack of coordinated safe access by the Israeli authorities. These denials and severe access constraints are paralyzing the ability of humanitarian partners to respond meaningfully, consistently, and at scale. Overall, the rate of access seen in January so far presents a significant deterioration when compared to the rate of access in December of last year, where more than 70% of the planned UN missions to the north were coordinated and undertaken. The rate for January 1st to the 10th is about 14%. Every day that we are unable to provide assistance results in the loss of lives and suffering of hundreds of thousands of people who remain in northern Gaza. Yesterday, our emergency relief coordinator, Martin Griffiths, said in a social media post that, quote, the health sector in Gaza is being slowly choked off as hospitals continue to come under fire, and what happens when the health system collapses. Pregnant mothers can't deliver babies safely, children can't get vaccines, the sick and wounded cannot get treatment, people die, and this war must end, Mr. Griffiths said. He also mourned yesterday the loss of 4 members of the Palestinian Red Crescent ambulance crews who were killed while on duty in Gaza. He said the rules of war are clear and that parties must protect civilians, including, of course, humanitarian workers.
So we're very pleased to have with us Dominic Allen, who's the UN FPA's representative for the state of Palestine. As we said, as Stefan said, he was just in Gaza.
I was terrified for the 1 million women and girls in Gaza, 690,000 women and girls at menstruating age, 5,500 pregnant women due to give birth in this coming month. That's 180 births every single day in Gaza right now. And during my visit, I met some of them, and I can't stop thinking about them. Many of them suffering from thirst, malnutrition, lack of health. If the bombs don't kill them, if disease, hunger, and dehydration don't catch up with them, simply giving life will. And we can't let this happen. And this is remembering the WHO reporting around 15 out of the 36 hospitals are only even partially functional right now. The rest not functional at all. It's unbelievable sights. I mean, it's dealing with 70 to 80 births in this one hospital every single day. 20 cesarean sections every single day. I met with Dr. Hannah, who is one of the lead obstetricians there, and between her incredibly busy life, she gave us a couple of moments and showed us the 5 delivery rooms that are there. The capacity constraints are such that the 5 birthing suites, pregnant women are having to rotate in and out because there's more of them than there are of delivery rooms. Women who are in their final stages of labor having to step out of that room to enable another pregnant woman to step in. So we estimate 18,000 births since this began. And we know that from the supplies we've been able to deliver and get in, our supplies have covered more than half of those births, but much more is needed. After a woman's given birth, she's given a matter of hours to be discharged. There's very little postpartum care which is being delivered to her and her baby. For cesarean sections, you would usually expect a minimum of 3 days to be retained in the hospital. Right now, they're having to be discharged up to, if they're lucky, if they're able to be, 1 day. It's shocking in terms of that. In terms of then the impact on the newborns, what we've heard, and this is more anecdotal. We don't have data at the moment to come to your question, but we have heard anecdotally some of the feedback from. I take the example of Dr. Bulbul, who is who's a lead in one of the NICU units of one of the hospitals there. He said anecdotally he's seeing higher rates of malnutrition, of below average weights of babies. And this is what Dr. Ragda at the Al Khair Hospital also reported to us. So we are concerned hugely because these are indicators that there are challenges through the last trimester of birth and then in their first moments of life, which are always the most precious. The supplies we're sending in are very focused towards life-saving measures for safe births. So they can be delivery kits, they can be, as I described, which was what was sent north, more clinical, reusable equipment, drugs and disposable equipment for clinical deliveries. Sometimes it can be referral level kits, which are for more comprehensive obstetric care where cesarean sections and others are needed. Given the lack of hygiene, given the lack of clean water, the malnutrition, which is highly prevalent. I think the statistic I saw is that 90% of Gazans may go without more than one meal a day. So the conditions are rife for communicable diseases to take hold, and it's something that the UN is deeply concerned about. The calorific and hydration needs for both pregnant and lactating women are higher. Lactating woman needs at least half a litre more than normal to ensure that there's enough hydration for her to effectively breastfeed. And then there's the other elements of privacy, dignity, and the psychosocial impact for that as well. And that is something our team, UNFPA, has heard, that mothers who were breastfeeding who are no longer able to because their milk sources have dried up for many reasons, including hydration, nutrition, and other issues. And of course, that then leads on to nutrition challenges for the newborns as well. This is something that we could refer to our partners in UNICEF and the World Food Programme in terms of nutrition, but you've seen the risks that have been made and the statements that have been made in terms of the risks of famine approaching, given the huge needs of food. But when we've spoken and we've been, I mean, this leads back to one of the other questions earlier around the support for women who have given birth. Given that they have to move quickly out of the hospital, we've been trying from UNFPA, we've been able to get some forms of postpartum kits, which not only blankets to swaddle the baby in, some newborn clothes, because that's another part of the feedback which comes from these pregnant women, noting that figure of nearly 18,000 newborns or births that have taken place. Their needs are huge and need to be met. In terms of from our staff from UNFPA, I visited all of them whilst I was there. We sat together, and they're all heroes in my eyes, but they don't want to be called heroes. It's same as the midwives and doctors. I even said to Dr. Hannah, who I referred to, and to one of my staff members, Mustafa, when I call them heroes, they look at me as if I'm saying something foreign. They say, no, this is my duty. I'm here to either, whether it be Dr. Hannah to help deliver safe births, or Mustafa in his incredible work in getting UNFPA supplies to the places that it's needed. He said that's what I'm here to. I'm here with my fellow Gazans to deliver for them. So their strength, they're still heroes to me, by the way, but although they don't want that label, but the impact on them and on our staff is huge. Whether it be them worrying about where the next meal is going to come from, whether it's worried about the insecurity of a bomb dropping and worried about being able to move safely to be able to deliver those supplies. These young people, Ahmed, Jomana, the doctors, the midwives in the hospitals that I met with, the IDPs, and UNFPA and the UN has been very clear. This must stop now, and ceasefire now.